Hey guys, this is Ada. I want to talk about vitamin D deficiency. First, I'm going to talk about the signs and symptoms of vitamin D deficiency, and then I'm going to talk about my own experience. Um, One of the signs and symptoms of vitamin D deficiency is feeling fatigued and tired and no energy. Um, those are one of the classic signs: bone pain, muscle pain, um, lowered immune system. If you're catching a lot of colds and different infections, you may have a low vitamin D level. Um, Vitamin D can affect your cardiovascular system. It can affect your nervous system. It can affect so many different systems in your body. And a lot of times, people haven't classically doesn't connect vitamin D deficiency with um, immune issues and infections and tiredness, and it can play a big part in your overall health. Depression can be a vitamin D deficiency. Well, with my experience, some of my signs and symptoms were depression, tiredness, heart palpitations, muscle pain, some joint pain, lethargy, just not able to function. And I wasn't diagnosed by a doctor, I kind of diagnosed myself. And I had been taking vitamin D throughout the years, but I would take like 1,000 milligrams or 2,000 milligrams sometimes when I thought about it. And I wasn't taking the cofactors like magnesium. Magnesium and K2 is a cofactor to vitamin D. In fact, the magnesium helped the vitamin D, and the K2 helped the vitamin D go where it need to go instead into your arteries. So my experience was just tiredness. That was the first symptom I experienced. I couldn't get out the chair. I know I hadn't been out in the sunlight. I lost my job, so I was pretty much in the house all day, and I just felt extremely tired. I just couldn't move. So that was my sign and symptom. I started supplementing with vitamin D, and my energy came back. I also started supplementing with the magnesium, which I would take it off and on, and I thought I was eating healthy enough that I didn't need magnesium, but that was not true. So I started supplementing with vitamin D, magnesium, and I found out you also need K2 to make it go, the vitamin D go where it need to go. And lo and behold, my energy came back. And a lot of the signs and symptoms that I was having began to minimize. But from what I understand, it can take up to a year for your body to totally absorb, reabsorb it. So you may have signs and symptoms for a while, but the energy for me came back, even though I was having other signs and symptoms going on. The energy was the big thing, and I was having like numbness on one side of my body. And I did go to a cardiologist, just to make sure nothing else was going on. In fact, I have a cardiologist that I go to wore heart monitor for 30 days. Then I wore one for 48 hours. They didn't find anything. Then I wore one for 30 days, and there was nothing found. But it was a very scary experience with the palpitations, the heart palpitations, and feeling breathless. That's another sign of vitamin D deficiency, feeling breathlessness. And when those levels start coming up, all this stuff kind of decreased. And so now I have my energy back, I'm mobile, and I do have some symptoms still, but it's nothing like it was. I would feel a sense of gloom and doom, and really, really depressed. And the list go on and on. And actually, my primary care prescribed me an antidepressant because he thought it was just depression, because my lab work wasn't showing anything that would contribute to my symptoms. And he was getting a report from the cardiologist that didn't reflect anything that was consistent with what I was feeling. So they just kind of chalked it up to anxiety. Well, I did finally get vitamin D tested, and because I was already supplementing from 10,000 to 5,000 units every day, my vitamin D deficiency and my vitamin D level was 50, and that was in the normal range. But from what I understand, optimal would be like 100. So that told me months before, I don't know what it was. It had to be low. Um, so I started taking, magnesium in amount to 500 to 600 a day, even though that's not recommended. I took it because I learned too that magnesium was a big cofactor in vitamin D deficiency. And with taking the magnesium, it lessened anxiety. It also helped me relax a little bit more. It did a lot of things for me, and I'll talk about that in another video. But the vitamin D was really key um, to helping me get my energy back. And my hair had fallen out, and guys, I cut my hair. I'm not gonna pull off my hair today, but I will. My hair had fallen out, so I ended up cutting it. But right in the these areas here was very thin, and now it's growing back, and my edges are growing back. So if you're experiencing hair loss, it could be a vitamin D deficiency. And my nails started to growing. They have broke a little bit, but they started growing really fast. So, there are other things that I did as well, but the vitamin D I think was the biggest thing for me. Um, and there's some other things I'll talk about in another video because I don't want to overwhelm you with information. But the classic signs for me were the tiredness, depression, infection. I kept getting urinary tract infections, um, lethargy, really depression, brain fog, heart palpitations. Man, I mean, it was a lot. And so once my levels started coming up, some of this stuff, the energy immediately came back. So, I was still having some signs and symptoms, and I'm still having minor, but I know it takes a while for my body to reabsorb it. So some of the things I started doing, I did start going sit in the sun for 10 to 20 minutes a day, which helped. I took the supplements, which helped. I modified my diet a lot. I was doing like a huge salad in the evening time, and I did like salmon and, um, avocado. But I will talk about the diet part too, because, salmon has vitamin D and vitamin B12 and all of that. But like I said, needless to say, when the levels start coming back up, I start feeling better because really, guys, it was a very traumatic experience. And I wouldn't wish it on my worst enemy. So if you're darker complected and you've had any of the signs and symptoms I talk about, you might want to talk to your healthcare provider and get vitamin D tested because you would think that would be one of the first things they would do, but it's not. If you don't ask, a lot of time they won't do it. But if you ask, they will. Most general practitioners will go ahead and test what need to be tested. So guys, get those level tested because vitamin D is very important to your overall health. And then with COVID-19 out there, it's very important that you keep your immune system up. I'm not a healthcare provider. I'm not a nutritionist. I'm not um, I'm not, I can't give medical advice, but I can tell you what I did, and I would, seriously think about, getting tested, especially if you're a darker skinned individual or you experiencing some of the symptoms that I talked about in this video. So thank you guys for listening. And I have one thing to show you, and now I'm not promoting any product because I'm not getting paid for it. But this is the one that I take. I take the Now brand, and this is 5,000 international units of D. And I'm taking 10,000 a day for a while to make sure I get the optimal levels. And so in the next video, I'll probably talk about the zinc and the other things and that helped me. And going back, I was having digestive issues too, guys. And vitamin D can affect the way your stomach and your gut work. And I'm going to talk about some of the stuff I did to help that area. The vitamin D was key, but there was also other things that I did that helped my body absorb the vitamin D properly. You need to take fat. When you take the vitamin D, you need to take with a high fat meal or a fish oil, or oil, some type of oil. This one happened to have olive oil in it, and you also need to take it with the cofactors for it to work properly. So thank you guys for listening. Thank you for tuning in, and I will come in and talk about some of the other things that I did along with the vitamin D to help me to feel better. But for a while there, guys, I feel like I was just gonna drop. So vitamin D is very important. I can't stress it enough. Getting your vitamin D levels checked. And especially if you had any of the signs and symptoms I talked about. It could be other things, but getting vitamins are very important. um, you know and I've learned so much over the last few months, going through my own trials and tribulations with my health. So thank you guys for listening. Stay tuned for the next video. If this video has been helpful, please like, share, and subscribe. Thank you.